will not be picked up. Each item has been presented. The committee will be asked to indicate whether they wish to speak by using the raise your hand facility in Teams. For information to members, the officers in attendance and presenting are Trish Armstrong-Child, who is the Chief Executive Officer, Southport and Ormskirk Hospital NHS Trust, and Jackie Moran, Director of Integration and Transformation, West Lancashire Clinical Commissioning Group. I also understand that 2 other officers are attending, but I haven't received notification of their names. Can we enlarge on that?
Hi, it's Trish Armstrong-Child. It's just Dr. Terry Hankin, our medical director, is just joining in. Apologies that wasn't presented earlier.
Dr. Terry Hankin.
Yeah.
Okay.
And Councillor Brickcliffe, I was wondering about bringing somebody else on my side, but I think you've just got me, if that's okay, from the CCG.
Okay, thank you, Jackie. Okay, so let's move on to item 1 now, which are apologies. I haven't received any, and I haven't received any notifications of any temporary replacements.
Yeah, excuse me, Chair, it's Gary. We do have 2 temporary replacements for today's meeting. County Councillor Jennifer Mean is replacing County Councillor Kim Snape, and Councillor Marilyn Proctor is replacing Councillor Jackie Oakes. Thank you.
Thank you, Gary. Item 2 are the disclosure of pecuniary and non-pecuniary interests. I shall take silence as meaning there aren't any. Nobody raised their hands? No. Okay. Thank you. Item 3 are the minutes of the meeting which we held on the 15th of December. I recommend that we agree the minutes as a correct record. Everybody
okay with that, Chair?
Okay.
Happy with that, Chair.
Okay, so they're moved and seconded. So we now move on to item 4, which is Shaping Care Together, the Shaping Care Together programme, transforming hospital and community services in West Lancashire, Southport and Formby. We're now going to have a presentation introducing the Shaping Care Together programme.
Thank you, Chair, and I'm going to lead on that presentation if that's okay. I'm reliably informed that Gary has the slide deck. Is that right? I can't see you, Gary. That as if by magic. So for those that don't know me, I'm Trish Armstrong-Child. I'm the Chief Executive at Southport and Ormskirk Hospitals. I've been with the trust just on a year now. So it's nice to come to this meeting for the first time, and unfortunately the events of the last year have prevented a lot of my time being able to get out and meet people. So thank you for the invitation today. I know there's been some supporting papers that have been sent round, but I just wanted to take the opportunity just to go through very high level really where we're up to with this Shaping Care Together programme. So can we have the next slide, please, Gary? Thank you. So what Shaping Care Together is, it's a programme of healthcare professionals across Southport, Formby and West Lancs coming together to look at hospital services and how they should be shaped moving forward. Just to say, this is a programme of work that's been under development for quite a few years, and certainly before my time at Southport and Ormskirk. It was previously called the Acute Sustainability Programme, looking at hospital services and across Southport and Ormskirk site. But last year, when I first joined the Trust, I was very keen to make sure that it was a partnership between the Trust and the clinical commissioning groups of both West Lancs and Southport and Formby. Next slide, please, Gary. Okay, and the vision there, I mean, it's easy enough to read, but what I was very conscious about when I came into the organisation, I've just talked about a programme of work that had been underway for quite some time, looking at the services across the trust. But I think it's really important to make sure that any changes or transformation that we want to take from an acute hospital site, we make sure that there's no unintended consequences across the whole system. So it's about making sure that any programmes of work that we want to review, that we're making sure that they are integrated, because it's not about just four walls of a hospital, it's about how we serve a community at large, and that's extremely important for us. Next slide, please, Gary. So the question about why Shape and Care together is important. It is because for quite some time here, there's been a need to redefine how we're providing some of our hospital services. We're a small hospital with some very small services, and we need to make sure that those services are sustainable for many years to come. So I'll start from right and go to left. So obviously there's always the financial pressures of acute sustainability and making sure that we're providing value for money. And that's really important, but it shouldn't be the only factor that you start to redesign services. We've had some long-standing legacy issues at Southport and Ormskirk around workforce recruitment and retention. We have had for a long time some of the highest vacancies in our medical workforce. And a lot of that is to do with where we're situated, but also because of the small services that we provide. So thinking about different solutions and integrating with us is really important for us. Obviously, there's growing demands on the NHS services, both in and out of hospital. So we need to make sure that we keep up with the models and provide the best services possible. Things change very quickly over the years, so it's important that we keep up with those models. And there's no doubt COVID-19 and the pandemic's had an impact. And I've been asked the question quite a few times now in terms of why now, why are we starting this programme of engagement now, given that we're in the middle of a pandemic. But my view on that is, I think for the last year, what the pandemic has shown us is it's actually highlighted where we know that we need to start thinking differently about some of our services. And indeed, the pandemic has given us an opportunity to try some new ways of working out, albeit on a temporary basis. And a couple of examples that I'll give you is, in the last year, the way we've started to work and integrate with our community services to make sure that, first of all, we work together to keep our patients out of our A&E department where possible. And secondly, when people do need to either return home or need further rehabilitation, getting our teams to integrate in work. So there's been some really good successes, but they are just small shoots. And the second example I give around there is about the digital solutions that obviously, particularly in the first wave of the pandemic, when we weren't able to offer our normal service, our hospital services. There's a lot of solutions in terms of our outpatients becoming digital and ways of monitoring some of our more vulnerable in the homes through the digital solutions. It's not going to be the solution for everybody, but it's certainly something we should factor in as we move forward. Next slide, please, Gary. So, and another consideration when we look at some of our demographics, and the slide there just shows you in terms of in this area, the demographic makeup of residents over 65 is 26% compared to a national average of 18%. And it's really important that we start to think about hospitals not just being the only places of care. And again, that goes back to the integration and how we work more closely with our communities to offer people alternatives, because we know in terms of projections as the years go on, the population and the demographics, we will get an ageing population, so keeping up with the care demands. And for me, it's extremely important that people are given the opportunity, particularly when they're living with chronic illnesses, to be able to live their lives as freely and best they can, and accessing hospital services only when they need it, but more importantly, still being able to access the services they need to continue to live their lives in the local community. Next slide, please, Gary. Okay, so some of the challenges that we face, I think I've already touched on the fact that It is challenging and to be able to recruit the staff at the moment. So we need to think of different roles, and we're already on with that and starting to work with our higher education colleges to think about new roles and new ways of working. And although health is improving in a number of areas, there's still inequalities there. So it's really important that we think about that when we start to plan and shape any services. I just touched on before, life expectancy is getting higher. So people being able to live longer with chronic illnesses is really important. And the levels of long-term conditions we know in some of our areas are much higher, and there's particular areas around cardiovascular and respiratory diseases that we need to think about how we can help people to manage better in community and access services when they need to. Next slide, please, Gary. So the areas of focus through the Shape and Care Together programme, as you can imagine, this is quite a complex piece of work. I've already alluded to the fact that it shouldn't just be done in a standalone, just the hospital only looking at this. But these were quite some years ago, which were the high level areas that were felt that we needed to start to think about first. The frail and elderly care, which again I've just touched on, our urgent and emergency care, and making sure that our A&Es are there for exactly the purpose, and they don't find themselves as a default because there's not other services to access. Really important in terms of services for children, particularly those children that have got complex needs and lifelong conditions, and making sure that we can keep services as close to the community as possible. Considerations for our services for women, pregnant and newborn, and sexual health services there. And we're also looking into planned care and follow-up. And I think, again, I touched on one example there, but it is only an example about how do we make sure that our planned care and our follow-up of our patients after that is the most convenient way that we can possibly offer to people. So they are the sort of main areas that we're focusing on, and that's why we think it's really important to come out and talk to people at the very, very beginning before we start to plan anything. Next slide, please, Gary. And this is a bit, if I was to plot down in terms of where we've been and where we're planning to go to, you'll see back there, if you look on the left-hand side, 1998 started with reviews and reports of local services and some suggestions even back then of how services should start to look. And it has been since about 2018 a journey that's been started with clinical engagement within the trust just before my time, really, looking at how we can start to shape this. We know that any potential changes take a long time, and so they should, because they need to be planned and thought through properly. And when I came in December of last year, that was one of the main focuses for me as a chief executive officer, to start to move this programme on with some focus. Unfortunately, nobody was planning for a worldwide pandemic, so obviously we had to halt that work during the sort of COVID first wave at the beginning of last year. But in the summer, that's when we got together again and started to put our programme governance together. And that's been really important for ourselves as a hospital, but working with very closely with the clinical commissioning groups, that anything we do and plan, that we do it in a process way. We make sure we do it the right way. We've got a map that we're trying to follow as best we can in a COVID world, but we make sure that we start on the right foot, and that is with the public comms and engagement. And I always have to stress this at every meeting that I talk to. This is not consultation at this moment in time. There are no definite plans. This is about going out and doing our first meaningful listening exercise to make sure that we can get feedback from the service users. Next slide, please, Gary. So it is about the listening to the stakeholders. So we actually went live with that just before Christmas with our own staff in Southport and Ormskirk. And then we went out from the first week in January to the public. So it's an exercise that's going to take us quite some time. So the kind of questions that we are asking people is, what works well at the moment? What do you think needs to be improved? And what's important to you? we haven't got a pot of gold where we can make every suggestion come true, but it is about getting those themes, because it's not for me sitting in an office to come up with plans about how I think we should reconfigure services. It's a must do for me that we make sure that it's the service users, that people actually have the everyday experience of our services, that have a say in that. So it's what we're very keen to do is we don't sort of go out there with an unintended expectation that everything that's said people will receive, because that would be impossible. But it is about listening to those services and what we could provide differently. Next slide, please, Gary. So this is how we've been asking people to get involved. We've got our website now, which you can see there. For people who aren't comfortable using a website, we've actually got a contact number so people can receive printed information and have the say. In the next couple of weeks, we're going to start a series of events where there's going to be workshops, which are going to be virtual, where there'll be discussion groups. We absolutely recognise that in a world of COVID-19, that how we traditionally engage, we can't possibly do. So it's not like we can open up big venues and ask people to come along. We've got a team of engagement and communication experts working alongside us here to give us some advice and guidance to make sure that, because we want to do this well and we want to do it properly, to make sure that we're thinking of every way possible that we can reach out to people in our community to have their say. We're working with the voluntary sector, with Health Watch, to identify potentially hard to reach communities, to make sure they can get involved in it. We've got a series of people going out into local shops that are open, pharmacies, even down to the vaccination centres, where people are having to wait that 15 minutes before they can leave after the vaccination to get information material in there, how people can feedback. So we are trying far and wide, and what we'll do after the initial phase of communication engagement is we will actually take a view about how far wide reaching we've got out to, and we also take a view at that point whether we need to go out again and further make sure that we're communicating. So that's how we're doing it to the public, and obviously having the opportunity to come to an overview and scrutiny committee like we are today, to talk to yourselves about making sure that we get the messages out, that people are really clear about what the ask is and the direction of travel forward. And I'm very comfortable to share that roadmap, but the only caveat that I'll give at the moment is obviously we are continuing with this programme of work, but COVID in its own way brings its own surprises. But if there's any time that we think we're unable to carry on delivering this effectively because of the pandemic, then we'd constantly go back and review. And we do meet on a monthly basis as a programme board, and that's part of the consideration and evaluation, because we recognise it is a risk at this time, but we actually think it's a really good opportunity, because we know anything like this is going to take a little bit of time before anything comes to fruition. So I think I'm going to stop there. That's just a bit of a whistle-stop tour really about where we are at the moment, but I know we've also provided some documents in the pack. And I'm more than happy to take any questions at this point.
So, members, can I remind you that we're using the hands up? So, if you wish to ask a question or speak, can you indicate?
Excuse me, Chair, it's Gary. We've got Councillors Nikki Hennessy and Gail Hodson wishing to speak in that order. Thank you.
Right, okay. It's Nikki Hennessy, County Councillor Nikki Hennessy.
Good morning, Chair. Thank you very much. And hello, Trish. I don't think we've met at all.
No,
nice
hi.
to meet you.
Hi,
and Jackie, we've communicated on a number of occasions. Well, first of all, obviously, I'm dead excited about the work you're doing. But my question, first of all, is to you: are there any services that you're aware of at the moment that we don't have, and you can see there's going to be a need for in the future? And I was just going to ask about your work alongside your staff and your volunteers as well. You know, your community engagement with them. you know, you're asking, how did that go? You know, at the moment, the method, I wanted to ask how's that going at the moment? What's your numbers like of people in engagement? And when you're asking people what's important to them, you don't know it's important to you until it is important to you, you know. So how do you get over that? It's a big ask. And the other thing is just to bring to, you know, forefront. I'm sure you've mentioned, you've thought about it, but you know, I've got to say, the likes of my dad, who's 89, and you know, very recently, we've been using your services, and I must admit, we can't fault you at all. You know, on a personal note, definitely not. And I think the likes of my dad's voice, but I'm speaking on behalf of everybody's dad, you know, at that age, you know, how do you get them involved?
Yeah.
COVID, you know, remotely, you know, because that's a big thing. I must say, we've just got Wi-Fi put in his house, but that's more for us so that we can do our work while we're there, you know. So there's my questions. Thank you so much.
Thanks, Nikki. I'll try and answer them in terms. So the thing about how do you know about, you know, what services you think you haven't got at the minute that you may need. So I guess one of the things, I mean, we've touched on it about long-term conditions, but I certainly think in an age after COVID, we're going to have to think long and hard about. We know that we're going to have a lot of people that are going to have long COVID. And require some services. So I think that's one of the things that we need to think about moving forward in terms of how we're going to build that in, because the need for cardio and respiratory rehabilitation. So as more comes out about this condition and disease, I think that's something that we need to look at. And I know we talk about this all the time, but it's a bit about we need to get much better at thinking about the public health message as well, you know. So it's about, you know, we've talked about it for many years, but how do you get into the prevention agenda? But for me, that's where the integration comes in, because it's like a circle that goes all the way around. Somebody described it to me once as like a cartwheel, and that's really important. So you have to make sure that they're all lined up. So for me, right on my mind at the minute is something that we've not thought about before, is about the long-term effects of the COVID disease, and that's something that we need to think about. You asked me about the staff and how we're reaching out to staff. So what I would say about that is we've had some staff focus groups. We'll continue to have the staff focus groups. We've actually got, as part of our programme board, a risk register. And on that risk register is the risk of engaging staff, because, you know, it's that question of, is this the right time when everybody's in the middle of the pandemic? Are staff going to be sort of focused to do that? Now, we know it's an absolute risk. What we're looking to do with the engagement team is, I was going to say when things start to settle down in February, but I really don't think that's probably the case. But at some point, what we're trying to look at is if we can start to do some facilitated on-site sessions with our staff, so we can get some focus groups together. I did some before Christmas. I did a series of one every day, and I had about over 200 staff that took part in that, which was good. But if I'm really honest, when I talk to staff in terms of what's coming back from them and what's important to them, number one, they're really proud of the services we deliver here, so they're really keen for them to stay local. And number two, and again, I'll be really honest, there's been so much discussion about Southport and Ormskirk and the future over the years. They just want some clear direction and vision about what's actually going to happen. And I think that's really, really important. You can keep on avoiding some of the hard questions, but it's really important for staff. So do I think at the end of all this that all staff will agree with all things? Probably not, but that's a human nature thing. But I think having some very clear direction is extremely important to them. And certainly when I came into the organisation a year ago, that's what people were saying to me, particularly the clinicians. And because, you know, they come in to do a good job and they want to serve that community. So that's important. And the thing about the channels of communication for the older population, that's why we've been really keen to employ the expertise of comms and engagement teams who've done this kind of work 100 times before in different community settings around the country to make sure that we're getting to all forms, all forms of communication. So we say terrible things sometimes like, oh, well, the elderly don't like the internet and IT. Well, that's a dismissive thing because a lot of people of an older age do use it. But I think for me personally, it's about recognising the contribution of carers in this. I think that's really, really important, particularly with our population with dementia. When they haven't got a voice, our job is to go and find their advocate who's got the voice for them. So we're really keen to make sure, just given on that slide I said about our demographics, it's absolutely key that we make sure that we provide communication, not just for people, but for their carers as well. And that's why we're very keen to work with Health Watch and the voluntary sector over that.
And Nikki, we've talked about that before, haven't we? The dementia hub and whatever. That's why we're working with CVS and Health Watch to say what groups are meeting currently and how can we get into those groups, to try and hear some of the voices that way. In terms of responses, one thing we have done is put a number of our leaflets, posters, those sort of things in the vaccination hubs.
Yeah.
And actually, as a result, Nikki, we're seeing some really good numbers. What I'm constantly reminded by those comms experts is it's not just about numbers, it's about the comments and really listening to what people are saying. So although we're getting a good response, we're really trying to hone down in what's in, I hear what you're saying about people don't know what's important till it's gone, but we're trying to hone down on what people are telling us.
Yeah, can I just come back, Chair? Excuse me. Definitely, I'm so pleased that the process that you're taking and the numbers that you're saying, getting the feedback from yourself, Trish. But you do have a lot of volunteers, and so I'm presuming they're all part and parcel of your engagement within the hospital. And it's not just you don't know what you need until it really is important to you.
Yeah, it's an important point. I mean, I'm really proud and impressed of the volunteer setup we've got here because it is very strong and very vibrant and very proactive as well. So yeah, they're absolutely included in this.
And very kind. They're very kind as well.
Yeah, they are.
Councillor Gail Hodson.
Good morning. Thank you, Chair, and thank you, Trish, for your presentation. Can you hear me okay?
Yes.
Oh, fab. Just 2 or 3 questions, if I may. Because of the percentage of over 65s in the area and also the projected growth of the over 85s, those people, obviously, because of the longevity, will have had a vast array of experiences using the NHS. So from their point of view, they'll be able to give you such a lot of detailed information of their experiences in the NHS. So I hope there's a lot of focus on the fact that those people need to be engaged, perhaps not more than other groups, but essentially as well as other groups. And also, when you communicating with the public, if you obviously on Facebook, it's a cracking way of communicating. And have you thought about using other Facebook groups where you can put messages on? I mean, some of them are open forums, like the Tarleton Hesketh Bank community group, that's open, and so is the banks. But there's also other places like the Senior Rugby organisation in Ormskirk. And so if you think outside the box and think of different organisations, you could put messages on and ask them to communicate for you. That would widen your reach to the public in such a massive degree. Even golf clubs or different associations, if you just ask to join the group, or if somebody can sit rather than go around delivering leaflets, if somebody could take the time out and let the fingers do the walking, get in touch with as many community groups, various as possible, and ask them to communicate outwards. They've all got parents and aunties and uncles and relatives, and that's a cracking way of getting your message out. I just don't know if you've thought of perhaps looking at that side of it as well. Thank you.
Thank you. I know Jackie's got a hand up and she's been doing some great work with the comms and engagement team, so I'll let Jackie answer that.
Thanks, Trish. Gail, that's a fantastic idea. One of the things we're using, and I must admit, it makes me feel like a dinosaur, a Facebook boost. Apparently, if we put something out that mentions Southport, Ormskirk, Tarleton, Banks, all of those places, it will find all of the groups, and it will hopefully post on those groups. So I'm hoping, Gail, we're getting into that. If not, you know, if you know of any that we're not highlighting, then please, if you want to suggest them to us, more than welcome to sort of piggyback on that, because you're right. We want to get into as many places as we can. We want to hear these voices. So yeah, would welcome it, Gail. Welcome it.
Please, can I come back, Chair, please?
Yes, certainly.
Yes, yeah, fantastic. The only thing is with that, if it just signposts the name and a link is sent across, it isn't personalised. If you could put a personalised message in, look, this is urgent. This is what's happening. This is your chance. You've got to say, we really are taking into account local views. We want your local experiences. These are essential for us to move forward. If you have sort of a real sort of message like that, appealing to people to personally get involved and help, say, look, we need your help. This is your time to help us, rather than just a link, which a lot of people, to be honest, if they just see the logo and the link, they'll just scroll through. Yeah. So if somebody could just spend it a bit, I mean, if you just go into the search bar on Facebook and just put Ormskirk groups or Skelmersdale groups, West Lancashire group, you know, SAT, whatever, you will then get a list. And you can just, if you have like a cut and pasted message ready to say, you could just do it that way, but it just makes it a bit more personal. And I think it would engage people more. Years ago, we did, I know West Lancs, when they do consultations, they usually get about 2.5% of the population responding, 1.5 to 2.5%. Locally, we did a village plan several years ago, and we personalised the leaflet with like a questionnaire on the back saying, look, this is your chance, this is, you know, we need your support. We got over 25% response, which was a cracking response rate, because we made it personalised, and, you know, we sort of said, we really need you, it's your chance to get involved. So it's just another way of communicating.
Brilliant. So we've got somebody doing social media now, so we will get that up and done and much more personal. I take on board what you're saying. Thanks very much. Thanks.
Right. I'm going to bring in Councillor Bridget Hilton, but I'm going to ask the Deputy Chair if he will take over the meeting for a few minutes, because my screen is frozen and I can't see hands up. So Gary, if you could get someone to call me, I will try and get back in as soon as possible.
Yeah, that's fine. Thank you.
No problem. Councillor Hilton.
Thank you, Chair. Can you hear me?
Yes, we can hear you.
Yeah, okay. Yes, I want to say well done. I've been very impressed with your presentation, etc., etc. But I'm just wondering, really, if maybe you could give some consideration to thinking about perhaps promotion of wellness as well, because it's not always just about, you know, a sickness service, but moving into early intervention and prevention. And it just seems to me that there might be an opportunity for you to try to promote a little bit more of that. For instance, I think during the COVID, it's been now demonstrated, certainly to a lot of GPs and other community staff where I work, is that there's a great benefits from pooling, sharing information with each other, cross-fertilisation of thoughts and ideas, etc., etc. So it's just something for you to think about, that's all. Thank you. But the job that you've done so far, I think, is very good. So well done, and thank you.
Thank you for that. What I would say was that this started off as a specific piece of work, and I think I said at the beginning it was very just about, well, it's for the hospital to sort the hospital services out. But I think even in a short time, the way we're starting to think as a system, you know, so I think about my job as a chief exec. So my job isn't just about managing the four walls of a hospital. It is about thinking outside of that. And I think actually COVID has given us great opportunities as leaders up and down the system to start working much more closely together. And as you say, thinking about mind, body and soul, because that's really important. Going back to my comment about the cartwheel, you know, for that individual, it doesn't matter, you know, whether you're in a hospital or whether you're in the community, all those things matter. So I think we've still got a long way to go with that. So I wouldn't say just because it's not within the scope that it's not something that's sort of being thought of. It's just not specifically, but in terms of working with our other colleagues across the system in the community in our mental health. I think that's really important that we start. So that's our leadership responsibility, I guess.
Yeah. And could I just add to that, Chair?
Yes, Jackie, come in. Yeah.
I mean, Councillor Hilton, that's really important to us in West Lancashire. Councillor Pope will know, having sat on some of our partnership meetings, that we focus a lot on those wider determinants of health. We really do try and focus on the whole person. So we've been doing something through COVID called Winter Ready, which has really tried to focus on getting people to just make little tiny tweaks to their lifestyle to actually have a much more benefit for them during this COVID time. We've really wrapped around the shielded population, you know, and really tried to make sure that those that are isolated have got some support during this time. And we're working really closely with the police and the DWP and, you know, during this COVID time to look at how can we work and focus on some of these families and some of the issues that we're seeing out there together in a much more integrated way. So completely understand what you're saying, Councillor Hilton there.
Thank you, Jackie. I think you're right. Isolation is a major issue for so many people, specifically the elderly. Thank you. Councillor France, and then I'll come to Councillor Eddie Pope as well. Councillor France?
Yes, thank you, Chair. I'm interested to see your presentation because it reminds me very much of what's happening in Central Lancashire with the Our Health, Our Care programme. And I'm just wondering, Trish, whether you actually have any kind of lines of communication through with Jason Powlock, who's delivering that for Central Lancs, because I thought maybe there are perhaps pointers and lessons that could be picked up there that Our Health, Our Care have been through, because obviously we're a wee bit ahead of you with this. We're coming up to the pre-consultation business case now here in Central Lancs, and just to wonder whether you've thought about involving your MPs early on to get them on board, to see what you're doing and what the purpose is, and to actually actively engage with them, because they are there to represent the communities. And also, just to point out that the real sticking point in Central Lancashire has been the urgent care and emergency care. And I think that is one area that really needs to be handled with a great deal of sensitivity. And this is potentially what would, in your case, also be a sticking point if there are major changes on the horizon in that department, and just to alert you to that and to be aware of it and be very sensitive to the feelings of the local communities. Thanks.
Yeah, thank you for that. And just for assurance, when we came back in July and set up the governance structures and the programme board, so a couple of things we were really keen about was that we made sure that although we're dealing with our little bit of the world, it's really important that we understand what we're connecting to, because we are all interconnected, aren't we? So a couple of things. We've got a programme manager who links in, I'd say informally, in terms of other programme directors to understand how far they are, and actually share some lessons about what's gone well. You know, have my time again, what would I do a little bit differently on a practical level? And I think that's why the strong message that's come back from partners that have been through this before is the comms and engagement at the earliest point is key, because if you get off to the wrong start, you're going to muddle everybody up. So that's the lesson we've learned from partners. So in terms of making sure that we don't have unintended consequences any further on, but we're in a unique position, Southport and Ormsgate, because we're sitting over 2 STPs as well. So what we've tried to make sure is that we keep connected in with people, so we understand what's happening in other areas, because what we can't have is to do something that actually is going to have a detrimental effect on a potential plan somewhere else. So we are mindful of that. We have spoken to our local MPs just to brief them, really, just as we're briefing you, because going back to that communication, it's important that at the same time everybody gets the same information. And again, I'll say something brave and bold and frank is the issue around urgent care services. We know that's the absolute complexity in this system. So doing it right and getting it right in terms of the process is really, really important, because what we're trying to do is make things better, not worse. So it's at the forefront of our minds as we move forward with this.
Did you want to come back, Margaret?
No, I'm fine with that. Thank you very much.
Great. Thank you for that response, Trish. County Councillor Pope, Eddie.
Okay, good morning, everybody, and thank you, Chair, and welcome, Jackie and Trish. Just before I start, I'd just like to add Bershka Community Forum to the areas that need contacting. I'm sure Jackie will know on the partnership group, you've got representatives from West Lancs Borough Council, so she'll be able to pick up the consultation methods they use. And again, they are very good, as been pointed out by Nikki. Clearly, West Lancs is a massive area. You know, you're going from Up Holland, Wrightington, right across to the borders of Southport, right out to Tarleton, Hesketh Bank. Then you've got all the Southport area. So, as you say, it crosses over into Southport, into Merseyside and Lancashire. And I suppose I'm just wondering, how are you linking in with all the CCGs, similar to what Margaret was saying? You know, our health, our care is progressing, you know, at a fairly quick rate now in central Lancashire, but you've also got the impact of Wigan. You've got a lot of people from Skelmersdale and Up Holland who go to Wigan A&E rather than coming into, you know, Ormskirk or Southport. Southport is too far away for many of the people at the far end of Skem and Up Holland. You've got people from Tarleton, Hesketh Bank who go to Preston. You know, you've got people from Orton who go to Aintree. So it's how you're pulling all those together and, you know, liaising with all the other services. And, you know, you might have to make decisions later on that decide, right, okay, you're not going to provide some of these services, and they'll be provided in Merseyside, or they'll be provided in Preston or Chorley. So it's really some comment as to how you're dealing with that, please. Thank you.
Okay, Jackie may want to comment, but I'll start. So there's a couple of things. One of the things that we'll really ensure, well, we've started to do, but to make sure is, so to really have a detailed analysis of what we describe as sort of the flow. So understanding, you know, where our population, our communities are going to, because sometimes we make assumptions about, well, if you live there, you must access that services, but we're doing some really detailed analysis of that so we can actually understand where and how that's flowing, because that's important. Linking in at some point with other strategic partners in terms of making sure that there's equitable access, I think is going to be important. And in terms of this uniqueness for us, because of the two sort of STPs, so we've got Lancashire, but we've also got Cheshire and Mersey. So the healthcare partnership for Cheshire and Mersey are closely linked into this now. We've invited them to sit on our programme board, our oversight board, just so again there's an understanding that if there's two things going at a different pace, that we align them. And I think that's really important, because this again is some of the tricky areas that we need to consider. So there is a lot of complexities, and we recognise that. So, but making sure that we're linking in with the two STPs in terms of Lancs and Cumbria and the healthcare partnership on the Cheshire Mersey is important, and we are doing that at the moment. I don't know, Jackie, if there's anything you'd want to add to that.
No, I mean, you're absolutely right, Eddie. You know, we recognise with Wrightington, Wigan and Lee, we're going into Greater Manchester too. You know, and what we are trying to do, they're already rationalising services across Greater Manchester. So we're really trying to link into those, understand what they're doing. And I suppose, you know, we would hope coming here, you challenge us in some of those decisions. That's what I was, you know, going to ask you really, that you will be informed around some of the changes that are happening. And, you know, if you could also challenge us to make sure we've taken account of it, I think that would help us. So we are linking into Greater Manchester, as Trish said. we are definitely trying to link into the two ICSs. Not only do we know about our health, our care, but we know about HIP 2 that's coming.
Yeah.
And the change, you know, in the two big hospitals, maybe, you know, what might happen. So again, we've got a place on that board to understand what assumptions they're making in their modelling. But you're right, Eddie. You know, sort of it's a very big jigsaw that we're trying to play with here.
Yeah. Okay. Can I just come back in, Chair?
Yes, certainly. Eddie.
I mean, clearly communication with all the population in all the areas is very important. You know, I joined the health service on the 1st of April 1974, going back a long time. And on that day, Wrightington came in with Ormskirk. Wrightington has since been in with Wigan. It's been back in with Ormskirk. It's been all over the place. And I think it's important that the communication, as you are progressing, is continued through whatever channels, whether that be the local papers, you know, the champion is delivered normally outside of COVID to, you know, basically every house in West Lancashire. And I think that's very important. You mentioned you've got somebody on from Merseyside on your board. Have you got anybody on from Lancashire?
No, but we take it back into the Lancashire ICS board and do it the other way around, Eddie.
Right. And do you think that's enough?
Well, that's a really good question. A really good question. Maybe that's something we should take away and think about, whether there is a way of joining the two together.
Yeah. Because certainly at the Talton Hesketh Bank end, a lot of people go towards Preston.
They do.
Up Holland, Scam, a lot of people go to Chorley.
They do.
You know.
They do.
So
we met with the MP, Catherine, from that area.
Fletcher,
she made it very clear to us that that's, you know, we needed to have an eye on that, really.
Yeah.
You know, what was happening.
Okay. All right. I'll be interested in what comes back on that. Thank you. Thank you both very much.
Thanks, Eddie. I've got a question
It's Gary. It's Gary, Chair. We did have Andrea Kay wishing to speak, but I noticed she's just put her hand down. I don't know if you just want to double check that, please.
Okay, but I've also got a question from County Councillor John Shedwick. So, John? Are you there, John? Okay. Gail?
Coming. Yeah, coming. Yeah,
John?
Here we are. Yeah,
yeah, okay.
Yeah, obviously very impressed with the areas of focus, and particularly the stats you gave us of the rising percentage of elderly people. And I'm sure from even this meeting, the breadth of your engagement has probably increased. I just throw in there the parish councils as well. I was just looking on my machine as we were speaking. I think in Lancashire, in West Lancashire, Nikki will know, I think there's 20 parish councils there, can drill down into the communities. Would you indulge me, Chairman, just at the moment, just while I have Trish and Jackie on, to ask a question just slightly off this target? Are you aware in your area, both from the Hospital Trust and the commissioning groups, that you are claiming, or they are claiming, money from consequent planning applications where there's new buildings going up? And are you getting contributions as a condition from the builders?
So, Councillor Sedgwick, I would say very minimally. They're not really looking at the infrastructure, I would say. You know, maybe as much as we would require for Section 106.
Now, well, I was just asking you. You are obviously claiming both at a trust level and a separate commissioning group level. That was basically my question.
Well, we're asking the councils. I'm not sure the councils are claiming sufficient for the builders.
Now, it might be something, could I commend it to you to have a little further look, because I am finding now that for many years there is money to be had, conditioning money from building projects, and this hasn't really got into the system until very recently. So I would commend a very definite inquiry into that. Thank you for indulging me on that, Chairman.
It's okay, John. Got a question from Gail Hodson. Gail.
Thank you. Thanks, Chair. Just on the building on the 106 monies, and the SIL monies, the parish councils do get a 15% levy off the builder. And I know our parish council in Tarleton is very, very inactive, but they will have funds in there. So it might be worth appealing to the parish council chair, clerks direct, to put it on the agenda that this is an essential service that they could be offering to the community by doing a leaflet drop, because they'll know where the elderly people are as well that don't necessarily have computers and modern technology. So that might be a route of communication as well. Can I just ask a question on the situation where we have two small hospitals in our area? I was talking to a healthcare professional last night who was saying that currently when you call an ambulance and you're assessed within the ambulance, you could, if say it's evidence that you've had a stroke, you would be taken straight to Manchester because of the specialist neurological unit there. So is that going to be the way forward, that because we have two smaller hospitals that won't have large specialist units, in the future anybody within our area will automatically be taken out of the area to a specialist unit, cardiology or whatever? Thank you, Chair.
Thank you.
So what I'd say about that is there are some nationally recognised pathways for certain conditions in terms of best practice and having specialist units to look at that. Certainly stroke is one of those pathways that some work has been undertaken for quite a few years in this area in terms of looking to see whether, if, for example, you were residing in Southport and it was very clear that you'd had a stroke and needed immediate what they call a thrombolysis treatment, that you would be taken to a specialist area, which potentially for here would be Aintree. But the models are what I describe as a hub and spoke, whereby you would have your emergency treatment in the specialist area, but then look to be transferred back into the local area for rehabilitation. So there would still be a stroke unit as such, but it would be that life-saving, as I would describe it, treatment would be done somewhere else. They are nationally recognised best practice pathways. So although this is out of the scope of the Shape and Care Together, it is definitely a pathway that's being looked at in the system. I know that.
Thank you very much. Thank you.
Did you want to come back, Gail, at all, or is that okay?
Oh, that's fine. Thank you. Thanks, Chair.
Thank you. I don't seem to have any more questions from anybody. Anyone want to ask a question? County Councillor Eddie Pope. You're on mute, Eddie.
Yeah, I realise.
Sorry.
Sorry, just a comment regarding the last question. I've no doubt, having worked with the ambulance service a long time, that the control rooms in the ambulance service will have information continually coming in from the A&E departments, whether it be Southport, whether it be Wigan or whatever, and they will redirect people if some of the hospitals are overused, and they'll redirect them to other areas. And the same with stroke patients, although, as you say, I understand a lot will go direct into Aintree. Thank you.
Yeah, that's right. In terms of the ambulance intelligence, obviously when hospital trusts are what we describe as escalating, they do look to see what the activity at A&E is around. And as you can imagine, there's not a single A&E that's not pretty busy right now and continue to be. And the MWAS will make those judgments. But one of the things they do consider during that time is what they describe as the ambulance turnaround time. So how quickly are they managing to get people into the A&E, get the patient into A&E and be able to get back into their ambulance and go back, because that's really important for the next emergency. We're really proud at Southport and Ormskirk that currently we are managing to get our ambulances to turn around within 30 minutes. So that's really pleasing, because it means that's another ambulance on the road for the community. So that's an absolute focus and one of our indicators of what we describe as our patient safety. So that's key. I think moving forward for specialist services. So, for example, once an agreement is reached in a system whereby an acute somebody who's having an acute stroke who needs intensive support. Once that's been agreed, and if it is agreed that they go to a specialist centre, NWAS would automatically know the pathway of where to take somebody to. And that is based on, as I say, the national pathways, but also it's based on the research about it's a better outcome for you if you're going to go to one of the specialist services. You've got a 24/7 service set up.
Chair, could I just come back there?
Yes, Jackie, come in. Yeah.
So, the other thing that we're nowhere near developing options yet. We literally are just listening to our population. But as we get further down, hopefully around summertime this year, we will be doing some geographical mapping. So if we decide that we need to move services, for, you know, I mean, Trish always talks about the 7 miles apart between these two hospitals, but if we need to move, we will do some geographical mapping that will look at how people maybe from Skelmersdale would be impacted, or from Banks, or from, so that we know, you know, sort of who will benefit and who may actually we need to look at how we help those other people to access services better. So I suppose I just wanted to give Eddie some reassurance there that, you know, whatever changes will be made or may be proposed, we will be looking at that before we make them.
Thank you, Jackie. Eddie, do you want to come back, or is that okay?
Yes, please. Yeah, I understand that, Jackie. Perhaps we should have built the new hospital in Scarisbrick in between many years ago. I just wanted to ask again about mental health services and how you are liaising with the mental health services. Clearly, at the moment, there's massive demand. You know, people out of work, people lonely, you know, and it's really bad out there at the moment in the mental health field. So it's how are you liaising with them? I mean, I know we've got Ashworth, we've got centres at Ashworth and what have you, but can you just maybe give a comment about that side of things, please?
Sorry, Eddie, just trying to come off mute. So obviously, you know, in terms of Southport and Ormskirk, we've got two different mental health providers. We've got Merseycare on one side, and we've got Lancashire's LSCFT. Sorry, they've changed the name, haven't they? So LSCFT over here. I've just come off a call this morning where they've been talking about the mental health services and what they're looking to do, and they're very much, Eddie, trying to engage locally. So they have replicated what we're doing with our 5 ICPs. We now have a local representative, and we're looking at how they play into our partnerships, our PCNs locally. We've also been looking at some of Lancashire, some of their metrics, and actually they are significantly improving. You'll know, Eddie, that sort of they did have an improvement authority put on them. But they're doing some significant changes. They've got a new executive team in there, and it's really making a difference. Yes, completely agree. One of the things they were just talking about this morning was the children that they're currently seeing in the fallout of COVID. Not necessarily the COVID mental impact on children, although that is they are seeing that. It's more the vulnerable children, the children in the vulnerable families. So they're really trying to wrap around to those areas, particularly Skelmersdale, you know, where we have a number of those sort of families, to try and put some dedicated support in those areas. We've also obviously got the link into A&E. You know, we've got A&E liaison, so that if we're picking anybody up that's going into A&E, we can divert them out into more appropriate mental health services. So Eddie, I suppose we're keeping close. And yeah. The one thing we've just discussed this morning, we had police, DWP, social care on there, about what can we do more for some of these families and some of these children in these vulnerable families. How do we work together more cohesively? So hopefully something good will come out of that too. Yeah. I had to leave them, Eddie, so I didn't get to the end of the conversation.
Okay. Yeah, just to comment on that. I mean, I know in Lancashire there are a lot of good work going on suicide prevention groups. You know, which is very important at the moment to reduce the numbers in that field. And just really a question for Trish. I mean, I know Preston basically engaged and took on mental health nurses in their own A&E. And I just wondered if that was available at Southport, because that gives the expertise, if you like, right at the opening gate as people come into A&E. And I know at Preston that's helped a great deal.
Yeah, so we don't currently, but that's something that's not off the table. It's a model that I've used in previous organisations. What I would say is our staff are trained, go through certain elements of training. But what happens in the trust, we do every 6 months, we do a staffing review. Undertaken by the Director of Nursing and a team, and as part of that staffing review, one of the things that they do consider is skill mix review. So I couldn't give you the actual details of whether that's been considered so far, but it would be something that's never off the table, because I've actually worked in organisations where we brought mental health nurses into our elderly wards as well. That's worked very well. So it would be something, and I think I said before about, you know, it's not just always about the numbers, it's about the skill mix. So I couldn't say for sure that's something we're considering here, but it definitely wouldn't be off the table.
Okay, thank you.
Thank you, Trish. Gail Hodson, you want to come in again?
Oh, thanks, Chair. Thanks for letting me come back in again. I've just been on to the clerk to Tarleton Parish Council, and they've plenty of money in their coffers. And he said if you wrote to them, or I mean, I don't mind doing it, but if somebody would write to them and request they could put some funds forward for a local leaflet drop within the parish, that would be something they could look at. They can't use SIL money because that's allocated for community projects. But he said there are separate funds, and it would be something that they could look at the next meeting if an email is sent through to them. Okay,
thank you for that. We'll pick that up.
Yeah. Stuart, if I can just come in on the parish councils, clearly, I mean, I'm chair of a parish council, so I can get the message out. But I just wonder if it's worthwhile talking to Paul Rigby, maybe getting a grant from him as parish champion to be able to then send leaflets out in all the parishes. And it's maybe something we can think about.
Certainly.
Thank you.
Thank you. Does anyone else have a question? If not, Alan Hosker, County Councillor Alan Hosker. Are you there, Alan?
Yeah, first of all, I'd like to say well done to the NHS, because I think you're second to none. I think you do a great job. Both Trish and your presentation were fantastic today. I enjoyed listening to you.
Thank you.
Jack, what I would like to ask is this. I've noticed on my own experience, you know, if you're tracking trace and you've got your people going for these self, you know, big swabbing back of a mouth in Burnley. I was sat in a car park one day and I was watching how they work. And as good as it worked, I got other people. It's a concern, Jack. And what my concern is this. If people going in, you know, when you have your self kits and you have to do it yourself, there's a lot of people, and instead of going to staff and saying, we don't know how to do it, they were walking away. And to me, that was a concern. Because you get some places what they'll do it for them, and you'll get some people that are too proud to ask for help.
You're very right.
Now, if they've got any symptoms, that's a concern, because you're just walking away out of pride because you're scared of asking for assistance.
Yeah.
My other concern is just, again, it's a concern. I know I've heard your statistics on Southport in your different areas, but nothing come through about Burnley or Blackburn. And what I'm asking, what I want to know is how full are these hospitals? Have you know, like some people say, you're cracking at the seams, etc. And another question I'd like to ask is, in the northwest, meaning Accrington, Burnley, Padiham, you know, this area, are the CV viruses, are they coming down? It's just a general question that I can put to other people. Thank you, ladies.
Thank you, Alan.
Good question, Alan. I'm not sure I've got those numbers. The way we are getting the numbers, we're giving it for the Northwest. So I'm not sure I've got the detail that you were looking for Blackburn and Burnley.
Right, okay. It was just a question. But
no,
like I said, Jackie, the concerns were, going back to the first thing, the track and trace, it is a concern. Because if people do have viruses and be too proud to ask, where do we go with it? you know, I mean, the government, as you know, and you both know, we're trying to get a grip of this.
Yeah.
But if you've got people, and it only takes 2 or 3 of them to have that thing, that it defeats the object, doesn't it? It's just a concern.
It does. Let me escalate that, because obviously we've got a lead within the ICS across Lancashire and South Cumbria, and there's a lead within the LRF as well for the track and trace and the testing. So let me escalate that, Alan, and we'll see if we can.
Honestly, and like I said to you and Trish, you do a fantastic job, second to nothing.
Thank you.
You know?
Thank you.
Thank you.
Thank you, Alan. Anyone else have a question? I have one, if that's permissible. Just going back to the mental health issue, specifically for children who are missing out on sport, and that has a massive effect on people's mental health. I certainly know myself, if I can't do my morning spinning session at home, I'm like a bear with a sore head. So are you linking in with any sports bodies across the county to look into when as we come out of the pandemic, how sport and children can help with mental health to get rid of their stress and strains? Is that something that you look into as well?
It's a really good question, Stuart. One of the things we're trying to do with West Lancs Borough Council, they've got their furloughed leisure staff. So part of our Winter Ready programme was about trying to do that. What could we do socially distanced in a park where you can actually get some, you know, even if they're doing exercise in their own little square, you know, how do we do that? I'm sure it's something we would like to develop. And you're right, as we come out of this, we need to think about how we get people more active again. I'm not sure we've got plans on the table yet, but I think we've probably got the way to do it. We've got links.
Yeah, because there are certainly, you know, probably thousands of fitness instructors,
exactly, yeah.
council, you know, gym people who are chomping at the bit to get out there and help children. Because I certainly every morning, and I'm driving past a local primary school, the kids are out there, obviously key workers, children, with an instructor jumping up and down, socially distancing, and they're having a whale of a time, even in the drizzling rain. So it's something that I think we need to look into, because it can certainly be a path out of the situation that we're in. And certainly children are suffering so much in terms of not being at school, seeing their friends, and just hooked into these computers all the time, even if it's just, never mind them having their lessons online, but then they're having to meet their friends online as well. So they could be on a PC for 8 to 10 hours a day if it's not controlled properly.
Yeah.
So it's a major problem, whereas going outside for half an hour or running around is, you know, getting the blood pumping to the brain, that sort of thing is fantastic for the children. So I think it's something that we really need to sort of champion in the future.
Yeah. So could I just come back on something that's a bit of a tangent, if you don't mind on that?
Yes.
In terms of West Lancs and Skelmersdale, the one thing we are doing this summer, I don't know if you've heard of Brian Cox.
Yes.
Yeah. Well, we're bringing Brian Cox to Skelmersdale.
Wow.
And we're having a science summer school,
Fantastic.
Which is really trying to get our children into science. And one of the things we were wondering was, could we go out on the beacon? Could we go out, you know, he's an astrophysicist, isn't he, by background?
Yeah.
You know, could we go out there and get them out and look at the stars? And so, you know, I take what you're saying, Stuart. You know, we have got the wider determinants. We've got, you know, a real focus on the whole person. You know, health is a part of what we're doing, but we're trying to look at it all. So I just wanted to let you know that's happening. Hopefully, you know, out of COVID by July, we might make it happen.
Great. Well, thank you very much for that. Anyone else have a question? Well, thank you for a fantastic presentation. As someone who lives in Morecambe, it's great to see the rest of the county doing so well, and you're working so hard. I really appreciate all your efforts. It's fantastic what you're doing, and let's hope that at some point we can come out of this. We will at some point, but it's a long stretch, isn't it, at the moment? Yeah. Getting everyone vaccinated. I was talking to some very elderly residents of mine yesterday who were really pleased. They've just had their first jab, so it's a way out. Great.
And you know what we're hearing from staff is that's quite uplifting to see some of these residents almost dancing out of the vaccination centre. It's a nice thing to see.
Yeah, so my mother was certainly one, even though she lives in Chester. She was very happy to have her jab. Well, thank you very much, and look after yourselves. Take care.
Yeah, no, thank you for your time. It's lovely to meet you. Bye.
Right, take care. Thank you.
Stuart, thank you.
Thank you. Bye-bye.
Thank you very much. Stuart,
Are you
thank
back,
you for...
Peter?
Yes, I'm back. I was having problems with seeing the hands that were raised. And then when I went into participants, it gave me a screen and no icons. So I apologise to everyone about that, or I apologise on behalf of my laptop. Item 5 is the overview and scrutiny work programme, which we're asked to look at and agree the work programme. And I shall take silence. That means that you are all agreeable. Okay, we move on then to item 6, which is urgent business, and there is no urgent business. Item 7 is the date of the next meeting, and the next meeting of the Health Scrutiny Committee will be held in virtual form on Tuesday, the 23rd of March this year at 10:30 a.m. Thank you all for your attendance this morning. I have to say that I was glad it was a virtual meeting because the roads were very bad here, so it was good not to have to leave home. As I say, thank you all for your attendance. And Gary, can I just ask you and some of the staff to stay on, please, afterwards, whilst I talk about the difficulties I've had.
Yeah, that's fine.
Thank you, Chair. Thank you all.
Thank
Keep
you.
safe.
Bye, everybody.
Bye.
Thank you, Stuart. Thank you, everybody.